Hi Thomas, how are you doing? I believe you're due your blood transfusion. I'm just going to check the consent form with you to make sure that it's all good, and then I'll check your cannula to make sure it's working nicely. So firstly, can you just spell your name for me? Okay, that sounds good. All right. Next thing, can I ask you to just check, is this your signature? Great. All right, so now I'm just going to check your name band against the consent form and our prescription. So we have Thomas Hoggs, 834567, and your date of birth is 16 to the 1st, 1954. Is that correct with you? Excellent. Okay, so Thomas Hoggs, 834567, 16 to the 1st, 1954, and we have it signed by you, signed by the doctor, and it's for anemia. So I'm just going to go to your prescription, and it's Thomas Hoggs, 834567, 16 to the 1st, 1954, 834567, 16 to the 1st, 1954, and you are prescribed red blood cells for clinical code 3, and that is symptomatic anemia, which matches your prescription, and we have this one signed by the doctor as well. Okay. Are you happy for the blood transfusion to go ahead? Good. Right. So now I'm just going to put some gloves on. Right. And I'm just going to flush your line to make sure that it's working nicely before I send for the blood. Right, just going to clean this for 10 seconds. And let it dry. And this is a PosiFlash that I had checked with my colleague before I came here. So it's sodium chloride 0.9 and expires 2022. So while that alcohol is drying off your cannula hub, I'm just going to expel any air. And then flush it through. So I'm just checking to make sure that no signs of inflammation, that there was no heat from this area, and also checking for any signs of infiltration as I'm flushing. And it's going in nicely, there's no resistance. So how does that feel for you? Okay, good. I'm just going to disconnect that. I'm now going to fill in the form, the request form, for it to pick up the blood. And we'll see you shortly. Here we go. Right. Just confirm that. So I've got Thomas Hoggs, 834567, 834567, 834567. We have red blood cells, red cells, red cells, red cells, and they are within date. Right, okay, let's fill this form in. So the patient name is Thomas Hoggs. Okay. 834567. Pack number is 37835510. Okay, so we've got 12 o'clock. So okay, right. Hi girl, are you free to do a blood check with me and then go and follow through with the ward?
Sure, that's for Mr. Hoggs?
Yes, it's for Mr. Hoggs, yes.
Okay, let's have a look at his charts here.
So I've just been and collected his blood according to the information I was given. So it's Thomas Hoggs. And you've got Thomas Hoggs on
Hoggs.
your... Excellent.
Red blood cells.
You have red blood cells there. We have red blood cells, red cells and red cells. And his urine matches our book. So it's 834567. 834567, 834567.
Okay.
So that's that. And then
his consent.
So we have Thomas Hoggs, 834567.
Signed. Anemia. Yep. Code 3. Symptomatic anemia.
Okay, so that matches.
All good.
So let's do a formal check of this. So I have Thomas Hoggs, 834567, 834567, 834567, 834567. His date of birth is 16/1/1954. 16/1/1954, 16/1/1954, 16/1/1954. Could you look up his blood group for me and we can confirm?
Okay. That's O negative.
Yep. And we have O negative there, O negative here, and it matches the donor group, O neg, and the pack is O negative.
Good.
All right. So cross match date on here matches here. And the expiry date matches, it's within date, but it matches the other label and the top label. Okay.
Pack number?
Pack number is 3783510. 3783510. And it's 3783510.
Okay.
We just need to check that it's all looking good. There's no signs of any clots. And the tubing looks good. All right.
Okay. So we just need to calculate the flow rate.
Yes, so I'm going to give it over gravity, so because our pumps are not compatible with giving blood.
Okay.
So we're going to use, the volume here is, did you want to use this paper?
Yeah, that's good.
So the volume on the pack says 251 mils.
Yep.
The prescription says we're going to give it over 3 hours.
Yep.
So that's 180 minutes.
Over times 20 over
and it's
1.
a 20 drop factor.
Okay.
So it's going to give her drops per minute. So you and I will then go to the bed and we'll check our pre-flush and priming solution as well.
That sounds great.
Okay, great.
All right, let's go.
Hello, Thomas. Right, we have got your blood, so we just need to do those checks at the bedside again. So what I'm going to do is get you to spell your name for us. Excellent, thank you. All right, now can you confirm this is your signature? Excellent, that's good. All right, so you consent for red blood cells because of anemia. Let's confirm that that is correct. So red blood cells, clinical code 3, and that's symptomatic anemia. You agree? Are you happy to have your blood today? Great. All right, so let's finish our checks. Can you tell me your name? So it's Thomas Hoggs, and your date of birth? 16/1/1954. Okay, and just looking at your name band here, it says 834567 is your URN.
834567, 834567.
Okay, so that matches our prescriptions, and now we'll go to our blood bag and we'll go through all that again to confirm. All right, so I have Thomas Hoggs, Thomas Hoggs, Thomas Hoggs, Thomas Hoggs. Okay, and we have the URN is 834567, 834567, 834567, 834567, 834567. Date of birth is 16/1/1954, 16/1/1954, 16/1/1954, 16/1/1954, 16/1/1954. Okay, so when we were in the office, we just looked up your blood group, and you're actually rhesus negative, 0, O negative.
O negative.
I'll get my words on tied in a bit, getting a bit tongue-tied. Okay, so now we just do the rest of the pack. So we have red blood cells, and according to our prescription, we are prescribed red blood cells, and we have red cells. Okay, patient group is O neg, O neg, O neg,
Yep.
and that matches the computer. The cross-match date, we have that there, collection date, cross-match, they all match. And our expiry, so we're in date, in date, in date. Okay, so our last one now is our batch number. So we have 3783510, 3783510, 3783510. Okay.
Okay.
Happy?
All good.
Right, I'll give you the sticker for the
Thank you.
prescription label, and before we move on, I'll just got my priming solution. So I have sodium chloride 0.9%, 50 mils, and June 20. This is because the ward here likes us to prime with saline.
Yes.
Don't always need to prime with saline.
Okay. All good.
But the board here likes this to be done. I also have my pre-flush, which is 0.9% sodium chloride, expires 2022.
Good.
All right.
All correct.
Gail, could you do me a
set of
favour and do a
obs?
set of obs for me?
Okay, and you'll prime the line.
I'll prime the line. And we've done our calculation as well, and we know the drop rate that we're going to be doing. And I'll put this here so I can prime into that. All right, we'll get going in a second and have you feeling better soon. And that looks to be good. Hang that up. I've got a blood giving set here which has the filter on it, and it's intact and in date. Close my roller clamp. Untwist the septum cover. Spike my bag. Fill my chamber to at least 1/3. And prime my line. So I'm going to give this by gravity, and the reason for that is not every pump is compatible with giving blood. Alright, so that's primed. I'm going to hang my bag. And we checked the integrity on the ward before we came to the bed. Just need to be careful because there's some water, some saline left in that spike without contaminating. And now I'm just going to prime the saline through and have the blood running before I connect up. So I'm priming into a receiver. And just be careful that you don't lose any of your blood product. Okay, Thomas, so that's ready to go. So I'm just going to do my pre-flush. Baseline obs, all good?
Obs are all great.
Excellent, thank you.
All within his normal range.
Cannula site looks good still. A score of 0. Flushing nicely, there's no resistance. No signs of infiltration occurring. Secure this line. And now set my drip rate according to our calculations. And slow it down. And that's perfect. Okay, so Thomas, you've got the call bell. I'm going to stay with you for the first 15 minutes, but if you're feeling any way different from how you're feeling now, please do contact us and call us straight away. We'll be in regularly to do your obs, to check on you and see how you're going. Okay, I'm just going to fill in your paperwork and we'll be back. Right, so just need to fill out our paperwork. Right, so just sign for this prescription.
You sign.
And start time was 12 o'clock. And then today's date, 20th of the 5th, 19. And his obs are all good.
Obs are in normal range.
Excellent. So I'm going to stay with Thomas for the first 15 minutes. And then I'll do another set of obs and I'll be keeping an eye on him. And then I'll come back and do a regular check and update his fluid balance chart as I go.
Okay, sounds great. Thank you.
See you later.
Bye.